The Lifestyle Show, presented by Selena Mackenzie.
Jack Elhai has written the book Face in the Mirror, which is about Andy Sandness, who had the first face transplant at Mayo Clinic. Welcome to the show, Jack.
Thank you for inviting me here, Selena.
And playing a song especially for you.
I'm so happy to hear that.
So, tell us about Andy. First of all, the Mayo Clinic, for those that don't know, it's probably the best hotel, certainly in America, possibly the world, isn't it? Sorry, hospital.
It's one of the top medical centers in the world, right? And so many people come from all over the world to be treated for all kinds of health problems. Andy Sandness, the patient that my book is about, didn't come there in any kind of pre-planned way. He was a young man living in Wyoming who was suffering from depression and various addictions, decided at the age of 20 to take his life and shot himself in the face. And he did not lose his life, but he did lose much of his face. And as a result, he was treated briefly in the small town in Wyoming where this happened, but then very soon airlifted to a place that could better treat and serve him, and that was the Mayo Clinic in Minnesota. And that's really how this book begins, Face in the Mirror. It begins with some about Andy's early years, but mostly with the start of his treatment at Mayo. And after he shot himself at Mayo, Andy received facial reconstruction surgery. That's not a face transplant, but that's an effort by plastic surgeons to make the best of what he had remaining in his face and to try and restore some function to it. And so Andy, he received that. The results were not wonderful. He did not have a great deal of function. His mouth was very small. He could not speak clearly. He could not eat normally and do many of the other things that he loved doing in his life. But he lived 10 years that way. And during those 10 years, towards the end of that stretch, he and his plastic surgeon, Dr. Samir Mardini, began talking about this newer procedure, face transplantation, that had begun to be performed in Europe around the time that Andy's injury occurred. And Dr. Mardini studied up on it. He got a team together at Mayo. They practiced on weekends using cadavers for almost 3 years before actually performing the operation on Andy. And the surgery took 56 hours.
Wow.
But it's quite a saga. And when I learned about this story before writing the book, I was just bowled over at all of the drama and the medical science, which I love, and all of the other emotional aspects of the story.
It's I knew he'd been shot in the face. I knew that a gunshot to the face, but I didn't realise he'd done it himself. The poor guy must have been such a dark place.
He was. And really one of the messages I hope that comes out of Face in the Mirror, probably the main message that comes out of it is that we see through Andy's treatment that suicidal people can be helped. And in Andy's case, he was vastly helped so that not only was his facial function restored through the face transplant, but also his mental health was improved during those years when he was under treatment. And now he's living a much better life. I have to say that Face in the Mirror is the only book I've written with a happy ending.
Oh, good. I'm pleased about that. I was looking at some of your other books as well. So I'm really happy that it's a happy ending for Andy. So how did you meet? How did all this begin for you?
This began through an earlier book that I wrote called The Lobotomist. And just briefly, it's a biography of the physician who championed and developed frontal lobotomy as a treatment for patients with psychiatric disorders. It's a dark and quite horrible tale, but one of the people who reviewed my early book proposal for that was engaged by the Mayo Clinic to try and find a writer for Face in the Mirror. And he had remembered my earlier book proposal for The Lobotomist and got in touch with me. And so I live only about an hour and a half drive from the Mayo Clinic. And so he and I went down there together in Rochester, Minnesota, and met with Andy and Dr. Mardini and all the other people involved. This is a story with many heroes. And we discussed it and decided that I would do it. And I was so glad that a wonderful story like this fell into my lap.
And it took you 5 years to interview him. I mean, you interviewed him over 5 years. Was that from just before the face transplant at the Mayo Clinic?
No, I came into the story after the face transplant had happened,
okay.
and during Andy's recovery from it. The 5 years that it took was because of because of many reasons, but the main reason was because of the COVID epidemic. And as a result of his transplant, and this is something that all transplant patients of any kind have to go through, he has to take drugs to suppress his immune system, which made him, during the COVID period, especially vulnerable to infection. And so for a while, we did not meet. We did talk remotely, but we had to discontinue our in-person interviews. And also the Mayo Clinic itself drastically changed how it worked. So a book like this, it's a lot of work, but it normally should not take 5 years to produce, but this one did.
And what was it like meeting Andy for the first time? I mean, was he open to talking to you? Was he a bit sort of nervous, was he holding back a bit?
Well, I have to admit, Selena, I was a little nervous to meet him for the first time. I didn't know what to expect. I'd seen some photos of him, but I didn't know what he would look like in person and how well he would be able to speak. All of those ended up being points that I shouldn't have worried about. But just in his personality, Andy is a reticent, not talkative person, and it took a while. A few interviews before he became comfortable enough and that we felt comfortable enough together so that we could start discussing some of the more difficult aspects of his story, like what led him to try and take his life and all of the roadblocks, all of the difficulties he faced while he was living with a surgically rebuilt face, and then after that with a face that had been transplanted from another person.
And for him to get to that terrible state of mind, did he have a tough childhood then?
He did have a tough childhood. I don't know if it was unusually tough. There was discord between his parents. They ended up divorcing while he was a child. But I think it was mainly a combination of where he grew up, the kind of person he was, and then the exposure he had while growing up to drugs and alcohol that led him into a kind of depression like that.
Yeah. And I understand he gave you permission to get all his medical records, and there were over 80,000 pages that you went through in order to do the book.
Yes, that was a terrific shock to me. I had requested to see his medical record. Andy almost immediately granted permission for that. and it came to me from the Mayo Clinic on a flash drive. So just from looking at that, I had no idea of what was on it. But when I opened it up, I did see that there were 80,000 pages, and even worse, and this must be a product of the way that Mayo keeps its medical records, the pages seem to be in no rational order to me, certainly not chronological or any other way that I could figure out. So I had to return that file to the clinic for them to rearrange for me chronologically. Once that was done, my task was much easier, but it was a mountain of work to go through everything, because as you can imagine, in a medical record like that, there are very important critical things that I did use in the book, and then things that were not usable, like his daily blood pressure readings, and so on. And so that was another reason why it took 5 years to do the book.
I can imagine. And obviously, the surgery was very complex. I mean, 56 hours is a long time. But what about the healing process? I mean, his nerves would have to repair. I'm assuming he had donor facial parts. I mean, did it take a long time to heal?
Yes, it did. And a face transplant is a special kind of organ transplant called a VCA, which stands for vascularized composite allotransplantation. What that means is that unlike in a liver transplant or in a heart transplant, there are many different types of tissues that are all being transplanted to the patient at once. And that includes, of course, skin and muscle and bone, but also nerve fibers, parts of the circulatory system. So it's extremely complicated, this procedure. And the recovery is extremely complicated. It took months and months for Andy to begin restoring his facial function. That is, for the nerves, the newly connected nerves from his donor to start working along with his own nerve endings. And so unlike one of the flaws of some earlier transplants that had been done was that the patients were brought out to meet the press too early. When their faces were still healing, they looked very swollen, and they had not regained a lot of their function yet. So Mayo's choice, and Andy's choice in this case, was to wait for about 6 or 7 months before Andy was brought out to the public and his story told. And as a result, he looked good and his function was good. Today, he looks incredible. I don't think anyone who would meet him would guess that he underwent a procedure like this. He probably has about 98% of his function. I keep telling him that he looks a great deal like Matt Damon.
He does. I'm just looking at before and after pictures now, and it is incredible the work they've done.
It is. One of the unusual aspects of Andy's case is that he had a chance, probably about 8 months after his face transplant, to meet the widow of his donor, who was a man similar in age and in looks and general skin tone to Andy. And she looked at Andy and really didn't recognize much of her husband in his face, except for the beard. Mm-hmm. So, of course, Andy inherited his beard from his donor. And there is a bare spot in one part of the beard that you see on Andy that also his donor had.
Incredible. And is he still in pain? Has the pain gone away?
No, he's not in pain. I think there is a sensation a sensation of, at the very beginning, I think of wearing somebody else's tissues, but that goes away after a while, and he's not in pain. He speaks very well. He can do anything with his face that anyone else can, for the most part. The main effect on him now is that he has to follow this regimen of medications to suppress his immune system. And he has to be very devoted to that, or else there's a risk of his body rejecting the transplanted tissues. So, and there are some restrictions on his activities. He needs to stay out of the sun and avoid certain foods that harm the effects of the medication, things like that.
Yeah, well, that's fair enough. And how is he doing now? Did he end up getting married? Is he living a happy life?
Yeah, I think Andy is very happy now. He not only ended up getting married, he married one of his Mayo Clinic nurses.
Oh.
And together now they have 2 young children, and Andy has gone back to work. So it really is almost a storybook, fairy tale kind of ending, completely unlike other stories I've written about.
Oh, I'm so pleased. And presumably, since Andy's transplant, there's been more since then, if he was like the first one.
He was the first one at Mayo Clinic. I think his order in the worldwide total of face transplants was 32, something like that. Some of the very earliest were done in Spain. And and there has been one other face transplant performed at the Mayo Clinic last year, one other since him. They've also done a hand transplant, which is a similar kind of transplant in the technique.
So clever. And I know you've written other books, Jack, and I was just looking that you're the author of The Nazi and the Psychiatrist, which was, of course, made into the movie Nuremberg.
That's right.
Wow.
That movie will be coming out in theaters all around the world in November. It'll be releasing in Spain, I understand, starting November 14th. And the path that book took to becoming a movie was very long, about 12 or 13 years. And it's thrilling that it happens. It's a great distraction. Sometimes I'm working on another book right now and I need to focus on my work, but I'm so happy that's happened. And I think I'm very devoted to that story as I am to the story in Face in the Mirror, and really love the idea of many, many people seeing it as a movie who would not get a chance to read it as a book.
Wonderful. Well, this book we're talking about is Face in the Mirror, a surgeon, a patient, and the remarkable story of the first face transplant at Mayo Clinic. It's by Jack Elhai, who we're chatting to now, and it is out now. Jack, for your other books and a bit more about the film, do you have a website people can go to?
Yes, there is information at my website, and the address for that is elhai.com, and that's EL-HAI.com.
Marvellous. Well, it was great to chat to you. Thank you so much for joining us today.
Thank you for having me here, Selena.
Been a pleasure. Have a good day now.
You too.
Bye.
Bye-bye.